Hey everyone, what's going on? My name is Emilio Corretta. I've been a dentist for the last almost 20 years. It's gonna be like maybe in a few months, we're gonna be 20 years where I've been out of dental school, doing it, here in the Wicker Park neighborhood. I've been here for a long time. We sometimes get these cases where they're cosmetic, and this particular case, a patient fell, had an injury to this tooth, and then the tooth started to darken. She ended up getting a root canal, and then a piece of it broke off when she was a kid. The dentist that she had did a phenomenal job. He did a nice bonding on there with the chipped area. But then after 15 years, it began to discolor. The tooth also began to discolor. She wanted to whiten this tooth. So it was just one tooth that was dark. So here's the patient's case, and as you can see, right there. So this is a tooth that's dark. You can see like all the other ones are lighter. The reason why this one is dark is because on the inside of this tooth, she had an injury, she had a root canal, and then this is typically what happens to teeth that are discolored. They begin to discolor from the inside. And then you can see here, here's the bonding that she had right there. You can see how it's like a little bit darker than the rest of the teeth. It just starts to discolor. The dentist that she had did a phenomenal job. He did a nice bonding on there with the chipped area. But then after 15 years, it began to discolor. The tooth also began to discolor. She wanted to whiten this tooth. So it was just one tooth that was dark. By doing traditional bleaching, where you would wear the trays and bleaching the teeth from the outside, it wasn't going to work because the discoloration was happening from the inside. What happens? The patient falls, hits that tooth. There's little blood vessels and capillaries and stuff inside that tooth. Those burst, and then it will cause discoloration inside the tooth. So if you were to bleach your teeth on the outside, that tooth will still stay dark. So she wanted to fix that. It was bothering her in pictures, and she didn't like that. When she smiled, she would see that one dark tooth. She had a really nice smile, nice teeth, and that was the only thing that was, not amazing. So she was thinking about getting veneers, and I said, hey, let's try this other technique where we bleached the inside of her tooth. So we basically placed bleach inside the tooth, made a little access hole there, and placed it inside the tooth. And there was probably about 3 treatments that we needed to do. And after a while, it started to change up, lighten up. So this is the result that we got. Tooth maybe slightly a little bit darker than the rest of the teeth, but way better. The bonding was changed out. Very difficult to see where the bonding actually is. Most importantly, what happened was we didn't have to do a crown or a veneer. Whenever you do that, you have to shave down the tooth. This is a young woman, and eventually those veneers and crowns have to be replaced. And so say that she lives to 80 years old, it would potentially have to be replaced 4, possibly 5 times in her lifetime. So, if this was my daughter, this is the kind of treatment that I would want for her. It's a nice result. She was very happy with the cosmetics. I thought that the results looked really good and conservative. So, if you are looking to improve your smile and want to get some ideas of what we could do to help, give us a call at 773-292-1911, and we'll set up your appointment. Thank you.